So hello, everybody. Good afternoon, good morning. My name is Zishan Kadar from the National Collaborating Center for Infectious Diseases. Welcome to the webinar jointly presented by Canadian Water Network and the National Collaborating Center for Infectious Diseases. We will be starting our webinar shortly. I will give a few seconds for folks to join. Nicolo, the floor is yours. You can start the webinar.
Great, thanks very much, Zishan. Welcome, everyone. Thanks for joining us today. I'm Nicola Crawhall. I'm the CEO of the Canadian Water Network. CWN is a national non-for-profit that supports decision makers in addressing complex water-related challenges at the intersection of communities, health, and climate. We convene cross-sectoral networks of professionals to promote peer learning and to catalyze collaboration and ultimately to accelerate action. Soon after the COVID pandemic hit, CWN recognized a need to bring together the many parties with a piece of the wastewater surveillance puzzle together into a wastewater surveillance coalition to engage in dialogue around how to work together, researchers, labs, wastewater utilities, public health experts, among others. And further into the pandemic, we recognize a need for public health practitioners who receive this wastewater data to share their experiences and learn from experts about how wastewater-based surveillance can be used as a complement to clinical data, how to interpret it, can it be used, how can it be communicated, and ultimately how it can trigger action in public health responses. So teaming up with the National Collaborative Center for Infectious Diseases as our strategic partner, and with funding support from the Public Health Agency of Canada and Indigenous Services Canada, we launched the wastewater surveillance program that you'll be hearing about today. While it's early days to arrive at the definitive business case for continuing wastewater surveillance, we've learned of many examples of the value of early detection of pathogens in the community through wastewater surveillance in triggering action at the individual, congregate, community, provincial, and even national levels. We've heard of examples like UBC, University of British Columbia, using wastewater surveillance on site to have early detection so they knew when to deploy rapid testing. We've heard of the same thing happening in many cities in long-term care homes. We've heard of a church that uses wastewater surveillance dashboards to determine whether to invite their congregation to wear masks or even to participate via Zoom. We've heard of a community that used wastewater surveillance to detect a mutation in an STD circulating in the community that triggered a change in treatment. And we've heard of a hospital that uses wastewater surveillance to trigger a mask mandate when necessary. So these give you a flavor of how wastewater surveillance is being used and has been used over the last couple of years. But the bigger picture that's interesting is at the ultimate end user point, which is the individual user. And what seems to have happened with these dashboards is that they've opened up a curiosity and an interest in individuals who want more open source public health data, kind of like having a smartwatch on to tell you whether you've slept well. It's all part of that wanting more data. And there's also a really interesting angle for Indigenous communities. If they can have control and ownership over this data, that can help them get a jump start when there are pathogens in the community, that their public health officials can handle an outbreak right from the outset rather than let it explode and have people come from the outside into the community to have to help out. So many layers of interest in wastewater surveillance and how it can be applied. But the question is, now that we're past the worst of the pandemic, what is wastewater surveillance's future in Canada? And this will come down to decisions in the federal government and the 13 separate provincial and territorial health departments that we have across the country. In some communities or regions, it'll mean that the program will expand. In others, they may bring it down to a very slow boil and then crank it up in the event of a new pandemic. And in still others, they may discontinue the programs. Whatever the decisions, it's important to think about the ultimate end user of this data, because it has been available to them over the last 4 years. This demand for open source public health data is strong in the community. It's a fascinating and rapidly evolving area, and I'm curious to see what this will look like in a couple of years across the country. I want to take this opportunity to thank our strategic partner, NCCID, our funding partners, FAC and ISC, our expert panel members, and all the participants of the program for making it such a success this year. And I will hand it over to our program manager, Talia Glickman.
Thank you for that, Nicola. To give you an idea of what's coming up over the course of this session, so I'll first be speaking, giving a bit of a snapshot on wastewater-based surveillance programming in Canada, and then I'll move to speak a bit more specifically about the CWN-NCCID Wastewater-based Surveillance Program overview, our achievements and key insights, and some potential ways forward. And then later on, I'll be introducing a couple guest speakers who are also program participants. And just a quick note that our Q&A is enabled, and I wanted to also thank everybody who registered and also suggested some questions that they might be interested in having answered. I know that we also have some interest in the more technical aspects of wastewater-based surveillance that might not be questions that our program can answer, but I know that we have a lot of expertise in the room, and I believe also some representatives from Public Health Agency of Canada. So I'd encourage, if you have questions in the Q&A, there will be commenting available there to speak to those questions. And also, if there are questions for our guest speakers when they are presenting, you can put those questions in the Q&A as well. To start out, I'll just give a bit of a snapshot of wastewater surveillance in Canada. So in early 2020, when a novel coronavirus started to look like it would be a pretty big deal, researchers around the world brought together their knowledge to start testing wastewater for the presence of this new virus. And globally and in Canada, methods came together very quickly with decades of progress in just a few short years. But now we're here in 2024, and with potentially the worst of the pandemic behind us, we now have some questions like, what is the value now of wastewater surveillance to public health? Do we have these sustainable partnerships in place to maintain wastewater surveillance for the moment and also be ready to scale up for future potential pandemics? And so with this sort of spontaneous inception of the use of wastewater surveillance for COVID and it being more temporary in nature, how can we continue? Should we? What will happen in terms of mandates? And so, as I've alluded to, prior to the pandemic, there was no systematic wastewater-based pathogen surveillance program, but the Public Health Agency of Canada established their wastewater monitoring for COVID in collaboration with Statistics Canada through the Canadian Wastewater Survey back in fall 2020. And this led to the establishment of a pan-Canadian network for wastewater surveillance in collaboration with various federal departments, provincial, territorial, and municipal governments, as well as research and academia. Currently, the Canadian wastewater surveillance network covers more than half, about 60% of the Canadian population on a sewer system. And the FAC program covers about 27% of the sewered population and monitors wastewater for COVID-19, influenza, and RSV. So diving a little bit deeper beyond that sort of national level of wastewater-based surveillance programming, there are lots of varied and intersecting partnerships and players in wastewater surveillance, as you can see on this very colorful slide here. So from the national level to the provincial and territorial level, which in itself are really 13 different systems making up this patchwork, each being responsible for the mandate in their particular provincial province or territory. You know, we have provincial systems that are centralized, like in British Columbia, decentralized, like in Ontario, ones that monitor mainly urban centers or maybe monitor, say, 2 sites, like in Quebec. and those that monitor rural, remote communities, including Indigenous communities. There's so many players here, I can't possibly go over them all, but there's plenty of, innovative projects in place here, like those from Genome Canada in terms of genomic monitoring and wastewater-based surveillance. And like I said, there's too many to go into now, too many partnerships and players, but the bottom line is beyond this being sort of a complex ecosystem of wastewater-based surveillance, we've also cultivated these impressive and largely unprecedented partnerships as well. So that whole ecosystem, it's kind of bred this environment with some opportunities and some challenges. So this is involved, as I alluded to in the last slide, many new partnerships between researchers, municipalities, and public health. And, not just with wastewater surveillance, but with every area of public health, we know that trust is central to effective collaboration, but building that trust does take some time. There's also the question around coordination and knowledge and data sharing across jurisdictional boundaries, across systems, from federal, provincial, territorial, regional, municipal levels with Indigenous communities as well, between, environment sectors like wastewater and public health. And there's also between researchers been very unprecedented and open knowledge and data sharing as well. There's also, as I've mentioned as well, the question of long-term funding and also provincial mandates. So far, all of wastewater-based surveillance has been done outside of requirement, and questions around whether provinces will make this mandatory are ongoing and need to be informed by a strong business case. There's also the question more so at the local level around application and uptake, which requires local understanding of systems, communities, and also there's been a lot of questions at the inception of our program and ongoing around proper interpretation and communication of wastewater-based surveillance at the local level. And that really brings me to, like I just said, the inception of this program between CWN and NCCID. So with that, I think it's a good spot to pass things over to Margaret Hayworth-Brockman, who's on the line, just to speak a bit about NCCID and the inception of our project.
Thanks, Talia. Yes, I'm Margaret Hayworth-Brockman. I'm the Senior Program Manager at the National Collaborating Centre for Infectious Diseases. We are hosted at the University of Manitoba on Treaty 1. And the NCCID receives core funding from the Public Health Agency of Canada. In fact, the National Collaborating Centres program was started at the same time as the agency as part of the response to and filling gaps that were noticed during the first SARS epidemic. Our mandate is to bring evidence and other knowledge to public health personnel to use for planning, programming, and policy. We do this by creating information resources such as podcasts, evidence reviews, webinars, posters, and so on. And really primarily by creating opportunities for information exchange. I have a little image of our website for front page there for you to find. Besides being interested in particular topics of infectious diseases that will be of importance to public health personnel, we have a few lenses that we apply across our work. We are very interested in public health in rural, remote, and northern areas, particularly with respect to First Nations, Inuit, and Métis communities. We have been, for a number of years, very interested in how different forms of big data can be used in public health decision-making and the ethical questions around that. And overall, of course, we have a very great interest in improving health equity and reducing health inequalities. Next slide, please. So during COVID, we could see the value of wastewater surveillance building, particularly in certain settings. Nicola has touched on a number of those, and for us, we were at the time thinking about corrections, long-term care facilities, and shelters in particular. We were approached by the agency to help host essentially their federal webpage, where their main way of communicating the initial and now ongoing wastewater reporting from across Canada. It includes guidelines and maps and so on, and others will be able to tell you more about that content, but it is hosted on the nccid.ca website. but we ourselves were interested in helping public health personnel understand the opportunities to work with communities, what challenges there might be in data interpretation, and as I mentioned, the ethical considerations. And we were just starting to think through, how do we go about this? This is a new area for us, and where are the experts with the information that we could help translate to public health? And then Nicola called from Canadian Water Network. So just before I hand it back, I do want to thank Zishan Kader, who's doing the technical work here with Talia. But it's Zishan who has been mostly involved in this partnership and working with the program that you're going to hear about. Thanks, Talia.
Thanks for that, Margaret. And that's absolutely the perfect jumping off point to tell you a bit more specifically about our CWN-NCCID Wastewater-based Surveillance program. So as Margaret mentioned, it's in partnership with CWN and NCCID, funded by the Public Health Agency of Canada, Indigenous Services Canada, and NCCID. The first year of our program began in April 2023 and will be completed in March 2024. And so the overall aim of our project is to engage diverse perspectives on challenges, opportunities, and potential solutions to build resources for effective interpretation and communication of wastewater-based surveillance data in health regions and communities across Canada. And so the first phase of this project is really a demonstration project focused on a small group of public health practitioners from several provinces across Canada, all with varied experience in wastewater-based surveillance for COVID-19 and other pathogens. The core of our program are really strategic sharing groups, which are virtual monthly sessions with our public health practitioners aimed to facilitate peer-to-peer learning and knowledge sharing between our members and with content experts. So diving a bit deeper into our program objectives. So initially it was to identify and engage that representative group of public health authorities and practitioners to support knowledge sharing among those participating and to really create the foundation for a strong network of public health practitioners. Beyond this peer-to-peer learning and creation of this network, we also aim to assess the learning needs of our participants to guide these strategic sharing groups and also to develop materials to support effective delivery of wastewater-based surveillance. And these support materials are based on needs focusing on communication and interpretation of wastewater data, and also the ethical and appropriate conduct of wastewater-based surveillance, especially in collaboration with Indigenous communities. And just as a bit of a primer, these resources are currently being developed and will be available on our website. So please stay tuned for those in April 2024 for a variety of case examples and tools and lots of key insights from our program. So in terms of our strategic sharing group members, we have a varied geographical distribution. We have 28 SSG members with 10 serving Indigenous public health regions, representatives from 5 provinces and positions ranging from medical health officers or medical officers of health, environmental health officers, epidemiologists, and those involved in research as well. In terms of organizations, we have representatives from Indigenous Services Canada, provincial public health, local health authorities, and labs. Guiding the program as a whole is our expert advisory group, and the aim of engaging with these experts is for them to provide oversight and diverse expertise in wastewater-based surveillance. So we have current members, Dr. Wendy Pons, Dr. Michael Becker, Dr. David Patrick, and Carrie Johnston, as well as our former member, Dr. Doug Manuel, who are all, very key to the inception and continuation of our program. And you'll notice we have expertise from around the country, from federal, from provincial level, and also from research as well, to just provide some well-rounded and diverse expertise. So at the beginning of our program in spring 2023, we started with a needs assessment of our program participants. And so as a part of that needs assessment, we had a few overarching themes, which I won't dive too deeply into. And so we started with 2 virtual sessions and then an in-person summit where our SSG members had the chance to meet with our EAG members as well as federal partners to get together for presentations and interactive activities to confirm these results you see here from our needs assessment. So the key learning topics that we identified in our needs assessment are separated into these 2 streams, which are reflected in 2 streams of our SSG. So the first stream of our SSG is focused generally on communication and interpretation of wastewater-based surveillance data. And so these topic areas included finding a signal in the noise. So things like examining external data collection factors that influence analysis for trends. So for example, behavioral, environmental, so things like precipitation and snowmelt and other methodological issues as well. Then we had the topic area identified of complementary but different data. And this includes interpreting wastewater data in conjunction with other public health surveillance streams, particularly in conjunction with clinical data. And then in this stream, finally, we also identified translating data trends to action. So where are those trigger points when it comes to wastewater-based surveillance where we can take action? And so that is that first stream. And these 2 orange boxes represent the key learning areas for our Indigenous, rural, and remote communities stream. And the areas identified here were sampling solutions, so everything to do with strategies and challenges around obtaining, testing, and transporting samples with rural, remote, and isolated communities, as well as ethical considerations, which really encompasses different areas such as building partnerships with communities, examining like data privacy, issues of anonymity, granularity, and also understanding ethical principles of data sharing and ownership, things like our OCAP principles and data sovereignty and the importance of those things. There are also other areas such as location-based targeted surveillance and illicit drug surveillance, which have come up as areas of interest for our participants time and again, but for this year of our project haven't been the focus. So in terms of the content of our strategic sharing groups, just to give you some highlights, as we've had plenty of more in-depth discussions in these sessions, we had 10 sessions, or as of next week, we will have held 10 sessions in total. Some highlights included a webinar with Dr. Amy Kirby, who is the lead of the U.S. Centers for Disease Control National Wastewater Surveillance System, speaking on best practices around communicating wastewater data and the overall future of wastewater-based surveillance in the U.S. as a whole. Next week, upcoming, we have an SSG session on First Nations principles of ownership, control, access, and possession, which is a training session with the First Nations Information Governance Center. Back in December, we had a session with Esri where they presented on GIS applications in wastewater-based surveillance. And we've also had multiple SSG sessions with representatives from various local and provincial public health departments, including Durham, Ottawa Public Health, BC Centers for Disease Control, One Yukon Coalition, and also Health Science North Research Institute. Another exciting event that Canadian Water Network held was our Blue Cities Conference. So back in October 2023, typically this has been a conference that is focused on water utilities, and this was the first year where we had a public health and wastewater-based surveillance stream. Notably, we held a national dialogue on the future of wastewater surveillance featuring Guillaume Poliquin from NML, Dr. Natalie Pristajecki from BCCDC, and Dr. Thomas Piggott from Peterborough Public Health, as well as our own Margaret Hayworth-Brockman from NCCID. Also, as a part of our program, we contracted an external evaluator to conduct an evaluation, and thus far we have some preliminary findings, essentially that our demonstration program has achieved what it set out to achieve, and that of those surveyed, those being SSG and EAG members, SSG members most stated their needs were met, and all SSG and EAG members supported the program's continuation with some suggestions for the next iteration of the program around, further geographic distribution, different ways of sharing learnings, and continuing with the current model of peer learning. And that brings us to sort of our next steps. So at this time, CWN and NCCID have submitted a proposal to the Public Health Agency of Canada. And really, this is for an extension of our current program for another year, still maintaining our sort of key tenets, so around peer learning and convening, knowledge sharing, building the capacity of public health practitioners, all of this being led by expert guidance, and still continuing our key activities of a needs assessment, strategic sharing groups, an expert advisory group, and an in-person summit. But we've also, throughout the course of this first year of our project, found some potential areas for expansion. And so first of all, we've identified a potential area in our proposal for a new Northern Indigenous stream. And this is basically building on the experience of the Indigenous stream of SSGs in this year of our program from 2023 to 24. And we have proposed to FAC that this next year of our program could focus on the unique circumstances experienced in isolated Indigenous communities in Northern Canada with a separate SSG for these public health providers and community members. We also have proposed provincial public health forums, which would be centered on building a dialogue amongst provincial health authorities on their current experiences and future plans for centrally funded and coordinated wastewater surveillance programs in their respective jurisdictions, while also still providing opportunities for these health authorities to hear from our SSG participants on the value of wastewater-based surveillance in their own work. And finally, we are also excited to conduct our program in English and French as well, just as an added element as well. And that, I believe, is where my presentation comes to an end. So I just wanted to thank you all and also introduce some of our guest speakers. I will just note that we have a couple of our program participants on the line. First up, I'm happy to introduce Carrie Johnston, an expert advisory group member. As a founding board member of the One Yukon Coalition, Carrie plays a crucial role in the adoption of wastewater monitoring throughout the Yukon, alongside enhancing public health communications and data management strategies. Amid the COVID-19 pandemic, she served as the COVID coordinator for the Champagne and Asiac First Nations, leading the establishment of Yukon's first community-based wastewater testing laboratory. I will also note that we will have time for questions again at the end of the session, but if questions do come up that you thought of during my presentation on our program, or that you think of during Carrie's presentation, please do put them in the Q&A. With that, I will stop sharing and I will pass it over to Carrie.
Thank you, Talia. And I'll just pull up my slide deck here. Carrie Uye Johnston Iche, Dakwakara Huninje Kuchanche. Good morning, everybody. My name is Carrie Johnston, and I live, work, and play on the traditional territory of Champagne and Asiac First Nations in beautiful Dakwakara Haines Junction. And for those who are familiar with the Yukon, that's about 90 minutes drive outside of the capital city, which is Whitehorse. I'm actually in Whitehorse today, so I'll acknowledge as well that I am on the traditional territories of the Kwanlin First Nation and Ta'an-Quechin Council. I live within the Yukon with great gratitude for the 14 First Nations who we serve through One Yukon Coalition, and acknowledging that 11 of those First Nations are self-governing and creates a wonderful opportunity for us to honor treaty and live, work, and play together here. So as mentioned, I worked during the pandemic for the Council of Yukon First Nations, as well as Champagne and Asiac First Nations in COVID response. And it was through my work with the Council of Yukon First Nations and Yukon First Nations COVID response that we developed the concept of One Yukon. And we are today a nonprofit organization that was founded in at towards the end of the pandemic, actually, like as an organization, in April 2023, and we serve to support public health communications and the advancement of the wastewater monitoring program here in the territory. And we work closely with First Nation and municipal governments in order to do that work. Here in the territory, the majority of our wastewater systems are operated and owned by municipalities, but often serve very closely First Nation communities. And so we during the pandemic, we learned a lot about public health. Public health is all under the auspice of the territorial government now. We're actually in the midst of an amazing transition here in our healthcare system as we adopt the principles of putting people first, which was an independent report tabled to the government in May 2020. So it kind of went a little unnoticed just because of the timing of when it was tabled, but really a transformative report that gives a really clear pathway for how we need to transform the Yukon system to better serve Yukoners and the First Nation population here in the territory. And that work is well underway in terms of implementation, and includes the transition out of our healthcare system out from under a department of Yukon government and into a true health authority, a health authority that is built in collaboration with Yukon First Nation governments. So we're in the midst of some really exciting times here in the territory, and One Yukon Coalition is here to ensure that in transition, we don't lose any of those lessons learned, those critical lessons learned during the pandemic and the impact that we saw a pandemic have, especially in our remote communities. And so we're here to create readiness for the next public health emergency, to better understand data integration and collection at the community level and how we can leverage that data as community together. And as I said, empower change during a time of great change in our healthcare system here in the territory. So as mentioned, we were originally founded and funded under the Council of Yukon First Nations as part of our pandemic response in March 2020. Part of the work that we did, through the Council of Yukon First Nations was do really the most comprehensive debrief on the pandemic in the territory. And we divided it into our unique phases because every jurisdiction had a unique response and experience with the pandemic. Because of our remoteness, we were isolated. We had a lockdown for the entire territory where if you came into the territory from outside our borders, you were required to isolate for 14 days at the beginning of the pandemic, and that was relaxed throughout the pandemic. And so the first couple of months of the pandemic, we cheekily call the, oh crap, we're in a pandemic phase, as we were all responding rather urgently and creating new structures for that response. And then we had our first reopening. Then we welcomed the new normal as we reopened our schools and kept them open in September 2020, and then we welcomed vaccines. And as you can see, we had very few cases for the beginning of the pandemic. It was barely a blip on our graph here because of those closed borders and the tight lockdowns that we had here in the territory, although we were able to reopen our schools. And then we experienced our first real wave of COVID-19 after the full rollout of vaccines. I really am proud of the work that we did on vaccine rollout here in the territory. Where I live with Champagne and Ajax First Nations, we achieved 99% double vaccinated within the first 4 months of rollout, and it was gratefully received here. And then we move in after our first real wave. We heard from First Nations leadership that we really needed to enhance our testing strategies. We had really limited access to testing. All of our tests were being flown out to British Columbia to be tested outside the territory. We had no real locally based testing, and we didn't have any rapid antigen tests. And we knew that we were really underserving critical populations within the territory here, especially those who have faced systemic racism and oppression within the system and are reluctant to access healthcare services. And so we needed to figure out ways of bringing testing to the people, and that began our relationship with the National Microbiology Lab and the great staff at the JC Wilt in Winnipeg. And so we introduced rapid antigen testing and the gene expert devices into First Nation communities first, and then YG followed. YG is Yukon government. And then, of course, we hit Omicron and all things changed, and we saw, an incredible number of cases coming here into the territory. And we've been working ever since then to learn from those phases of the pandemic and implement solutions so we don't face the challenge that we did again, which is between June 1st and August 9th, 2021, we saw our first real wave, and we saw and experienced that 56% of the cases, 63% of the hospitalizations, 56% of the medevacs, and 50% of the deaths. Sorry, sometimes those emotions still arise. Impacted our communities, recognizing that only 22% of the Yukon's population identifies as Indigenous. So the work ahead, we prepared a report acknowledging what we heard from leadership during the pandemic, which is available online, and there's a QR code there for you to access the report on how we need to prepare for the next pandemic, because we know one will come. And a couple of those key points is to develop data governance and data sharing agreements to ensure mechanisms are in place for future emergencies. It really depended on who was our CMOH, how we would be able to access any data really about what was happening in any of our communities. And there's important reasons why that was in place, like ATIP and data privacy and healthcare privacy for individuals. But it also we've got to find some middle ground, because it really left communities blind and in high states of anxiety, not really knowing what was happening in community. We also need to be mindful of how we collect Yukon First Nation specific healthcare data, and ensure that First Nation governments and citizens have access to the data that they need to make informed decisions in their community, and that we appropriately provide resources and funding to make those decisions and have access to that clinical guidance that's required, and that we can do all of this in a timely way. Oops. I'm having a hard time going backwards. There we go. Okay, so we received funding in 2023 to expand the program that we had operating in Haines Junction, and that is to look at the 7 different jurisdictions where we have the ability to implement wastewater monitoring programs. Not all of our communities have centralized lift stations, and so we are limited in where we can expand the program, but we are doing that good work now. We have programs running in Whitehorse and in Haines Junction currently. We're not currently sharing the Whitehorse data, as we've gone through some transition in government, and we're still looking to re-sign and to sign our data sharing agreements. We always want to make sure that we're moving at the pace of community. We do have new MOUs in place with Watson Lake and Liard First Nation, Little Salmon Carmacks First Nation, and the Village of Carmacks, and we're working with the government's First Nation Nutchonak Dun in Mayo, as well as Dawson City and Trondikwichin government. Although already we have about 79–80% of the Yukon population covered just by that Whitehorse-based data, as we are fairly centralized in the capital city. For the Haines Junction wastewater lab, we built where we could, and so we found an underutilized basement in the basement of the Renewable Resource Council office, and did some great work to reconfigure that. That's an early picture in the bottom right-hand corner of the space that we found to locate our mini lab. And we did some slight infrastructure modifications to the lift station in Haines Junction, which was relatively new, including creating a port in the lift station so we could put our auto sampler in, and as well add a hand washing sink for worker safety. We work really closely with the National Microbiology Lab. So our mini lab is using a gene expert device and collecting local data that we can then action within minutes. Once we're doing the sample, we're sampling 3 times a week. And we're also sending our samples out for verification with the National Microbiology Lab, as we acknowledge that this is still research when we're looking at such small jurisdictions with transient populations like we have. And as well, we send it out for sequencing. So the National Microbiology Lab now is presenting and preparing reports for us, which we then share with our community right now through the Champlain and Ajax First Nations website, although we're building a larger data portal for the territory. We're also investigating autonomous devices like the Kraken. We do have capacity constraint in many of our communities and logistics constraint. We were lucky in Haines Junction to have an underutilized basement, but in many of our communities, that kind of resource or extra space is just not available to us. We're in the midst of a housing crisis, as many of you are as well, although it's heightened in our northern communities. And so we don't necessarily have those spaces, and many of our lift stations weren't built with water, potable water access for hand washing or anything like that as well. So there's some major shifts in infrastructure that would need to happen. So we are looking at autonomous devices as being a solution to capacity. As I said, we share out our information on the Champlain and Ajax First Nations website right now. We are building a new dashboard for One Yukon Coalition, and we share it out more broadly on the Government of Canada's national dashboard. We're participating in a number of research initiatives as well, because if you're collecting data, what are you going to do with it? And that includes another a main initiative, which is called Attitudes Towards Vaccination, which is a research grant between Yukon University, SPORE, the Council of Yukon First Nations, and One Yukon Coalition to understand where attitudes are towards vaccinations, as we've seen a pretty precipitous drop on COVID and influenza vaccines in the last couple of years now. One of the big challenges in such a small jurisdiction and transient jurisdiction like the community I live in Haines Junction, which has a broader catchment of about 1,000 people, but probably closer to 500 actually living on the lift station, although it does collect all of the main administration buildings and the school and healthcare center. But it is a very small jurisdiction. It is heavily influenced by the tourism economy and people driving through, as well as Alaska is a military state. And so you see a lot of troop transition between the lower 48 and Alaska, and often why we might see in our sequencing a variant that you might find more in like Louisiana or Texas, not necessarily in Canada, coming into our system because of that troop migration in the fall and the spring. We have a significant population that's on septic or pump out. We don't have a lot of processes for how we handle unusual samples. This summer, we had our samples come back out of the lift station that were viscous, deep yellow, and we still haven't really been able to determine why, and that ran for about 7 weeks and actually inhibited our ability to use the GeneXpert device. So there are sort of unique complexities to smaller systems. The friction of distance for moving samples between communities, we pool and send our samples in once a week to the National Microbiology Lab, but and that's takes an hour and a half to just drive them into Whitehorse, and then they go by FedEx, and it takes several days before they arrive in Winnipeg. And we have very limited access to clinical data. It takes many months before we see any results on the clinical, so that's hard for us to compare results.
Looks like Carrie is frozen.
Yeah, I think the call may have dropped for Carrie, but maybe for now I'll introduce our other guest speaker, and then if Carrie does come back on, she can speak for the rest of her presentation. Yeah, I'll maybe wait 1 second to see if Carrie pops back on, and then I'll just introduce, in the meantime, maybe I'll just introduce our next guest speaker on deck. So I'm happy to introduce Nancy Slip, who is one of our strategic sharing group participants. Nancy is a research associate with Kingston, Frontenac, and Lennox and Addington Public Health. She works mainly with the ACES project, which provides syndromic surveillance for Ontario on real-time hospital triage data. Although Nancy has worked in public health surveillance for over 10 years, her educational background is in analytical chemistry, so she feels very fortunate to be able to apply some of her previous knowledge to her region's wastewater surveillance project. So it's my pleasure to introduce Nancy for her to give a bit of a snapshot of the WBS program in KFLA.
Thank you. I may not see you if we we change back over into terms of talk. So just interrupt me, okay, Talia, if we need to change streams here pretty quickly. But thank you, everybody. Good afternoon, everyone. And I'm really happy to share a bit of our journey and our experience as a program participant in the WBS program. And I think it was probably just literally 1 year ago, I think tomorrow, that one of our utilities partners contacted me to see if our agency would be interested in participating in this project, and which of course we were really excited to do that. And we had already a great working relationship with our partners at Queen's University and our local wastewater treatment facilities in the wastewater surveillance initiative funded by the Ministry of Conservation, Environment, Conservation and Parks, pardon me, for Ontario is who's the major funder for wastewater surveillance. So we already had an existing great working relationship with these partners, but we wanted to be in this program because we were really excited to be able to collaborate, contribute, and learn from all the other public health agencies across the country. As I think, as we're seeing that we're working together to bring into being this new health surveillance tool. So who are we? KFL&A Public Health is one of 34 local public health agencies in Ontario, which are, of course, charged with safeguarding and promoting the health and well-being of their residents. Some public health units in Ontario are embedded within their municipalities, but KFL&A Public Health is not one of those, although we do receive a portion of our funding from the city. We serve the entire region that you see here in dark pink. We're about midway between Toronto and Ottawa. We stretch between these two well-traveled highways that run east-west, one near the top of our region and the other, the 401, at the bottom. But most of our population is really concentrated in the south, and more than half of our population lives in the city of Kingston. I think we were considered an urban participant for this project, but as you can see, we've a really small population compared to other cities, in Ontario and Quebec and elsewhere, and other participants in the project. But because of our small size, our data has been comparably easy to collect, organize, even interpret. So, for us, a lot of this is, working with the wastewater data has been a very, very positive experience and fairly easy to implement. But at the heart of our surveillance program is our wastewater treatment facilities, shown here as X's on the map. When we started our surveillance program, we were taking samples from all these sites that are shown here, including for the town of Amherstview, which is to the west of Kingston, in addition to the 3 sites within Kingston. And 3 of these samples were taken directly at the inflow to facilities, and a 4th was a pumping station that we tried to take as a subset of one of our facilities to represent our downtown core, which includes our hospitals and Queen's University. Our current sampling protocol has changed a bit. We've honed it to just be the 2 main treatment sites for the city of Kingston. So the sites that are circled here. But these 2 sites still give us access to sewage coverage for most of the population of the city of Kingston. How do we use this wastewater surveillance data? Well, back in the heyday of all those COVID dashboards, we had, a pretty in-depth COVID dashboard ourselves, and we included a graph of the COVID numbers showing for each of those sampling sites. Since then, we have revised and honed our reporting of the data to a more holistic respiratory virus surveillance dashboard. It provides guidance on risk management rather than detailed situational awareness. So in it, we assess community transmission risk using 5 indicators, with the information from wastewater being weighed equally to all of those other traditional indicators. And although we don't display the wastewater data, we do report on whether levels are low, moderate, high, or very high, if they're decreasing, unchanged, increasing from a previous week. And we did labor over the decision to remove the wastewater graph from the public dashboard. And ultimately, we decided to do it for the other reasons beyond these, but 3 main reasons. First of all, our numbers are quite variable, the data that we're getting from the sites. And our communications team and our MOH we're spending a lot of time explaining that a single day of elevated numbers or conversely low numbers didn't necessarily indicate that one's activities should be altered or that your relative risk was changed. We're a small health unit, we have a small population, we've got limited time and resources to put into just spending all that time explaining of the data. A second reason was that our lab partners at Queen's had just started analyzing for the targets beyond COVID. And we were really concerned that showing flu and RSV numbers without having any context for what that may look like or mean, maybe just be more confusing for our community than helpful. And the third reason is, although we are incredibly grateful to have these numbers available for our situational awareness, we are aware that these data really belong to us. So we are really interested in working through who should be displaying these data. Maybe perhaps these are the wastewater facilities, the cities, the funding agencies, the people themselves need to make these decisions. We're not sure. There's also the issue of maintaining the websites and dashboards and all these things, because these all take people hours and resources that can be trying at times in a local public health agency. So we're not sure of the answers to this, and these are a lot of the reasons why we're so happy to be involved in projects such as this, as we can talk these out and hopefully move forward as a group, so that our public health unit isn't necessarily doing something different from our neighboring, and that we can have some sort of consistent approach to this for at least, if not nationally, at least provincially. But that said, we do use the data exhaustively for our own, for the agency's situational awareness, and for our weekly meetings with external partners, and any circumstance where we're having these data available and showing it is important. We also share directly using Power BI dashboards. We share our internal dashboards with some of our hospital partners as well, so they have immediate access to this data as soon as we receive it from our partners at Queen's. We also compare wastewater results directly with hospitalizations and other indicators, and we really do look to wastewater for population view that's not possible from other traditional surveillance methods. So our participation in this program has been really helpful for us. It has created a community of practice, and that enables information and knowledge exchange among all these different participating agencies. And networking is so important to this project's development and even innovation. And certainly access to the experts through this program is a benefit between simply all those professionals that were in our group as well, and those international experts and others that you guys have brought to our meetings and our webinars have been just, it's been a great resource. But lastly, our point I really would like to stress too is that the interdisciplinary nature, that Talia, that slide you had of all the different people involved in this, it's like, it is just it is such an important point that you guys are bringing us all together. All these different professional groups don't necessarily speak the same scientific language, so us learning how to communicate has been so helpful, and I think possibly really important for the future of wastewater surveillance. There are a couple outstanding questions or issues, though, that we have, moving forward with this program, and both our, with the program we're talking about here, and also with wastewater surveillance and generally across Canada. First of all, it'd be really helpful that this program would continue as at least a community of practice, that the leadership and guidance that you guys are providing to us as public health, as we try to incorporate this all into our wastewater, into our workflows and our standard population health indicators, is invaluable. And then in terms for wastewater surveillance as a whole, there's so many things to consider. It's like, how is this sustainable, in terms of Ontario, and like, how is this going to move forward over the next couple of years? It seems that we're going to be continuing to have access to this data, but we're never quite sure beyond several months. So it's difficult to try to start incorporating things into your regular diet of indicators when you're not sure if this one will continue. Other things that we're concerned about too is just that flexibility of, quickly working at methods to adapt to evolving public health needs. And then really there's that how to improve that timely analysis and communication results so that you can enable fast action. And then the last one, and probably the most important one, is all those ethical considerations that we need to think through and work through, turn into policy, standard practices before we really move too far with what we're doing with different targets or different populations. So in conclusion, our journey with the WBS program has been both enlightening and rewarding. We are very, very thankful to the CWN and the NCCID for the chance to participate in this program. And we really do recognize all the efforts that you and your team have done and poured into our meetings and into all this work. And finally, I thank everybody else for their attention, and I'm happy to answer any questions.
Thank you, Nancy. I think we have time for a couple questions, and I'm also noticing that we have some questions in the Q&A. And Carrie, I know that your presentation had to end a little unceremoniously, and I can see that there's a question in the Q&A that maybe I can pose to you, Carrie, and then as other ones come in, we can pose to the group as well. But Alex has asked, are automated methods, and if you can speak to maybe specifically the Yukon experience, I'm thinking, are automated methods for wastewater monitoring something that you've explored for Yukon and for remote communities?
Yes. Yeah. So we're working with Kraken to pilot a couple devices in some of our more remote communities that are where there are specifically where there are infrastructure challenges in terms of developing a mini lab, and as well as capacity challenges. So stay tuned. We will know more. We are actively engaging in that program.
Well, thank you for that. And I'm wondering, since we do have just a couple minutes left, if there are any other questions for Nancy or other questions for Carrie, please feel free to put them in the Q&A just before we wrap up with this last minute or two. But I will also just say before we close that I would encourage you all to complete a quick evaluation that will pop up at the end of this webinar. And just to reiterate again, as I mentioned in my presentation, we are currently developing knowledge products as a part of the CWN-NCCID Wastewater Surveillance Program. And those knowledge products will live on both CWN and NCCID web pages, which I believe Zishan has linked to in both the Q&A and maybe the chat as well. So with that, if there's no further questions for our guest speakers or ones specific to our program, I'll just again thank our guest presenters, Carrie Johnston and Nancy Slip, for their wonderful presentations and for your time. And also just to reiterate thanks to all our expert advisory group members, to our strategic sharing group members, and our funders back in ISC as well, and NCCID. And I can see Zishan has put the link to the evaluation in the chat there. So again, thank you all. And yeah, just thank you all for listening.